After studying this module, you shall be able to know about bite marks and their importance, how they are classified, that means classification of various bite marks, how they are identified and how they are collected from various articles and objects, and what are the basics of bite mark investigation. To introduce you the topic, human bite marks are incriminatory evidence and have been found on various foodstuffs like apple, bananas, etc., human flesh on the human body and other objects, many other objects. Bite mark evidence help in the positive identification of offenders in many cases. It is shown how offenders of ferocious injuries were individualized from bite marks on the victim or the offender or on the foodstuffs found at the crime scene when the bite marks were matched to dental impressions taken subsequently, or you can say a representative human bite is described as an elliptical or circular injury that records the specific characteristics of the teeth. The human bite marks are found when teeth are used as a weapon. They can be used as a weapon of anger, they can be used as a weapon of passion, they can be used as a weapon of control or maybe even weapon of destruction. Although bite mark analysis comprises of only a slight portion of most forensic dentist caseload, if you compare with the whole caseload which a forensic odontologist or forensic dentist undertakes, they comprises a very minute quantity, but still they represent one of the most challenging aspect of the discipline, because the injuries caused by teeth, they can appear as bruises, abrasions, lacerations and even avulsion of the tissue depending upon the intensity and the duration of biting force applied. Because as you know, the skin is elastic and distortable, and this is the quality or this is the aspect which makes forensic bite mark analysis more complicated. And the human jaw grows and changes over the time, which makes teeth mark left by a suspect a few years before not always easy to match accurately to his teeth. However, often saliva is found on the bite marks, which can assist the law enforcement agencies with the DNA profile for identification. As we know, we can take the salivary swabs from the bite marks and later on subjected for the DNA analysis. Human bite marks are most often found on the skin of victims. It is the women or the fairer sex who are most often bitten on the breast, on the buttocks and legs during sexual attacks, during a sexual assault, whereas the bites on men are commonly seen on the arms, on the shoulders. The bite marks generally present as superficial abrasion and associated with subsurface hemorrhages or bruising of the skin. Coming on to the bite mark evidences. The bite mark pattern may be deposited within foodstuffs, the other objects, or upon the victim of an assault or during a homicide. The bite mark analysis in a forensic investigation can elucidate the kind of violence as well as the time passed between its production and the examination. The bite mark evidence inflicted by a deceased victim may also be seen on a living assailant if there occurred a lot of struggle. If we talk about the child, in children cases, other than those of domestic violence or physical or sexual abuse, in children the biting can represent a form of expression that occurs when the verbal communication fails. So the child, the only, you can say, the way of communication from a child is through biting. So bite mark is in general, if we talk about the characteristic of the bite mark, it is a circular or maybe ovoid, or sometimes it's a horseshoe shaped patches, they are found on the skin. And moreover, because as we know, the human adult dentition consists of 32 teeth and each one of them has its own size, shape and features. So that leaves the characteristic impression. The action of the dental arch on the skin may produce many kinds of lesion, as the dental elements, they act as an incisive instruments. The evidence of a bite mark is usually crucial to establish that two subjects have been involved in a violent contact in a crime scene. So the greatest challenge in the forensic dentistry are the bite marks found on the human skin because of the distortion presented during the struggle, as well as the time passed between its production and when we examine, that is during the analysis. So that's the most challenging aspect of the bite mark examination. Coming on to the type of bite marks, how many type of bite marks we usually see? As I said earlier, the bite marks are frequently encountered in cases involving sexual assault, brutal murder and child abuse, etc. These marks can play a very substantial role in leading to a conviction. We have seen the cases that on the basis of bite marks, there are so many cases which have been convicted on the sole evidence. And the biting is often regarded as a sign of the perpetrator seeking to humiliate the victim while also achieving complete domination on the subject, on the victim. Bite marks can be seen on any part of the body, chiefly on the soft and fleshy tissues such as arms or buttocks, which are easy to target. It always must be remembered that at the crime scene, one can also find bite marks on the whatever objects present in the vicinity of that. Additionally, they are also commonly found on the suspect in a case if the victim makes an attempt to defend himself. So during that process, the bite mark may be inflicted on the accused itself. So that correlates with the crime. We can divide into many types. One is the sexually oriented bite marks. These marks are most commonly encountered during sexual offenses, as the name suggests. Sexually oriented bite marks appear to have been imposed slowly and intentionally with the suction applied to the tissues by the tongue and the lips. The resultant injury which occurs, this displays a central or the peripheral suck marks and the marks of anterior teeth with good definition. So that's the characteristic feature of this. The amount of distortion in the impression may indicate whether the person was active or passive when the bite mark was inflicted. The second category of bite mark, we can say, is the child abuse bite marks. In the child abuse cases, either aggressive or you can say the anger bite marks or maybe sexually oriented type of bite marks, both can be seen. Bite marks in children, they invariably symbolize child abuse until proved otherwise. The third category of the bite marks are self-inflicted, and it's very commonly during a practice of forensic medicine we see that the person himself inflicts bite marks on his body and then tries to implicate the other person. They are mostly found on the forearms of children caused by them, because that is the most easily available weapon of offense to a child, his teeth, and consequently the bite marks. Sometimes the arms may be pushed into the child's mouth to make him stop crying, or due to intense pain, children may bite themselves to overcome the suffering whatever he is undergoing. The mentally retarded or the psychologically disturbed pupil, they may also impose bite on themselves. Self-inflicted bite marks are also seen in a disease what we called as Nehan syndrome, which is an X-linked recessively transmitted disease with insensitivity to pain. In this particular syndrome, what happens, the person is insensitive to pain. So the person who is having this X-linked disease, he himself, or you can say he self inflicts the bite marks on his body. Now coming on to the factors influencing the bite marks. What are the various factors which influence the bite mark formation? So, we shall be dealing one by one some of the important factors which affect the development of the bite mark. First and foremost is the type of tissue. As I told you, it is seen in the case of skin, if it is very loose or with the excessive fat. The bites commonly produce bruising, leading to a very poor definition. You cannot identify that easily if the excessive fat is there or the skin is very loose. Whereas in areas of the fibrous tissue or tissues which have got a high muscular content, they tend to bruise less, so that the definition of bite mark in this particular situation is very good. So one can easily identify a bite mark. Second feature which affects is the age. Extremes of ages, that means infants as well as old individuals, they have a tendency to attain more bruise than the individuals of other age groups. The sex of the person, if we talk about this particular aspect, the female, it is the female who tends to bruise more than the males, because of, again, they have got a you can say more subcutaneous tissue, more subcutaneous fat in their body, and they tend to bruise more than the males. Once produced, bite marks will be evident for longer period of time in females as compared to the male. So they last longer also in females. Time. The time passed between the actual biting and when the impression is made, this also plays a very vital role. After death, human skin has a tendency to contract, harden and eventually decompose. So this feature also affects the production of the bruise. Now, what are the various guidelines by which a bite mark analysis is done, or how a bite mark can be analyzed? As we know, this bite mark analysis, they are considered as a dynamic. They are not static. Every day the science is changing, and as the science is evolving, every day there are so many changes are occurring in the understanding of the concept. So they are liable to be modified as significant development evolves. So making the careful use of that available guidelines in the evaluation of bite marks, this will enhance the quality of investigation and the conclusions which can be drawn upon afterwards from that. Now, if a bite mark is found on a human body, whether it's a victim or accused or maybe on the object also, moreover we are more concerned when it is on the human body. So how to describe in a scientific manner that particular bite mark? So we shall be discussing this aspect in further detail. In case of both, whether it's a living victim or a dead person, the forensic dentist or the odontologist should determine and record certain vital information in a methodical manner, like he must record the name of the victim. That's the first and foremost thing, on whose body the bite mark is present, so that should be recorded. Case number, that means whatever reference number of that case is there. If it's a dead body, it can be the post-mortem number. If it's a human being, live human being, it could be a medico-legal case record number, what we called as MLC number. Then the date of examination, on which date the person is being examined, because that information is very much essential, since the bite mark may have been inflicted 1 day prior, 2 day prior, 6 hours earlier, or maybe 5 days earlier. So according to the time lapse, the various findings will change. So the date of examination, and with the history that okay, what was the time of infliction of that bite, that is also important. Only then he will be able to correlate in a proper manner. Then the referring agency, that means whether the police, if it has been sent by the police or may be referred from the honorable court. So if it is referred by a police all the details of the police person, who is he, whether he is an SI, his name, his belt number, and to police station to which he belongs. All these details should be mentioned on that, and the persons to contact. That's the next point. That means whosoever is the IO or investigating officer, who is the person, authority to deal with that. That is also makes a part of the record. Then the age of the victim, of course, when we note down the particulars, then comes the age of the victim or maybe accused, it depends whatever case is there. So, age of the person which is being examined, the sex of the person who is being examined, that is you can say a part of the demographic profile, and the name of the examiner, name of the forensic dentist or name of the doctor who is examining that bite mark. That should also be mentioned on the report. Now, next aspect while describing the bite mark is the location. How to locate or exactly locate that bite mark. So, the following point should be kept in mind while making the exact location of that bite mark. Anatomical location. The second point is the surface, describe the surface contour, whether it is a flat, curved or irregular. Describe the tissue characteristics. What are the underlying structures like bone, cartilage, muscle, fat, and what is the condition of skin, whether it is relatively fixed or mobile. Then third point in the description is the shape of bite mark. The shape can be essentially round most of the times, but it can be ovoid, crescent or irregular also. The color of the bite mark, that should also be noted. The size of the bite mark. In size, the vertical and horizontal dimensions, both dimensions of the bite mark should be noted, preferably in the metric system prevalent. And lastly, it is also important to describe the type of injury inflicted while describing about the bite marks. The type of damage caused to the skin is also documented. Coming on to the collection of bite mark evidences, how, if we found the bite mark, how the bite mark should be collected. From the victim, it is presumed that the evidence gathered from the victims will be taken with authorization from the appropriate authorities, as I already told you. It should firstly be determined whether the bite mark has been affected by washing or not, by any contamination, by lividity, that is the changes after death, decomposition, the change of position. All the observations have to be recorded carefully. Then comes the photography. In photography, we have to have a specific orientation. In this particular case, when we take the photo of the bite mark, 3 orientation and close-up photographs of the area should be taken. 3, right? The photographic resolution must be of high quality. The accuracy of color balance should be assured in using color films. The photographs of the bite marks must be taken with and without scale in the place. And when a scale is used as a reference, it should be placed on the same plane and adjacent to the bite mark. In the case of a live victim, it might be useful to get serial photographs of the bite marks. Then salivary swabbing. When we see the bite mark, that whenever possible, salivary trace evidence must be collected as per the recommendations of the testing laboratory. We usually preserve the swab. We take the swab from the bite marks and hand it over to the police afterwards. Impressions should also be taken from the surface of the bite marks when it appears that this might deliver some useful information at a later stage. So, the impression ingredient, this should meet the American Dental Association specification and it should be mentioned by name in the report. So, that was about the victim. Now, coming on to the collection of bite marks from the suspect or from the accused. Before collecting the evidence from the suspect, the dentist or the forensic odontologist, he should ascertain that the necessary paperwork, all those has been obtained, and he should record a copy of this document to add to his record. History, as I told you already, history is very important. History in this context is the history of the victim or suspect's any dental treatment following to or in proximity to the date of bite mark that has to be obtained. Then comes the role of photography. To the extent whatever is possible, good quality extraoral photographs of both full face and profile should be taken. The intraoral photographs preferably should include the frontal view, two lateral views, the occlusive view of each mandibular and maxillary arch, and any additional photograph that may provide valuable information. In case inanimate materials, for example apple, if used as a test bite, that such foodstuff result should also be preserved photographically. And lastly, the impressions. Wherever feasible, at least 2 impressions as a standard sample should be taken of each mandibular and maxillary arch using the materials that meet appropriate ADA specifications and are prepared in accordance to the manufacturer's recommendation used globally accepted dental impression techniques. Now coming on to the basis of bite marks investigation, when we see how we analyze it. So often the differences in size and shape of teeth are very obvious to even a layman. For instance, when someone has teeth missing or very prominent teeth, a representative human bite mark is described as an elliptical or circular injury that records the specific characteristics of the teeth. The sizes, shapes and pattern of the biting edges of the interior teeth that are arranged in the upper and lower dental arches are thought to be very specific to the individual. This is mainly caused by the sequence of eruption of anterior and posterior teeth. Bite marks with high evidentiary value that can be used in comparisons with the suspect teeth will include marks from the specific teeth that accurately record distinct traits. So it is possible to identify specific types of teeth by their class characteristics. So to summarize the topic of this bite mark, human bite marks are incriminatory evidence and have been found on the foodstuffs, human flesh and other objects. The bite mark evidence helps in the positive identification of offenders in many cases. It is shown how offenders of ferocious injuries were individualized with the help of the bite marks on the victim or the offender or on the foodstuffs which is found at the crime scene, when the bite marks were matched to the dental impressions taken subsequently. Bite marks can be seen on both the victim and the suspect body. The victim uses teeth as the weapon, while in aggression as a self-defense. Although the bite mark analysis comprises only a small portion of most forensic caseload, but they are very important and they represent the most challenging aspect of the discipline of forensic odontology. Bite mark examination guidelines are well thought out to be dynamic and not static, and that's why they keep on changing all the time, and making the careful use of all those available guidelines in the analysis can enhance the quality of the investigation and thereby drawing the conclusions from that. The collection of the bite mark evidences from the suspects and the victims majorly involves photographing the marks and also taking the impressions.